gives me immense pleasure to be a part of this coalition as the member secretary. And because it is the only platform I know integrating both private and public sector in a single platform. So all the at present I am working as additional director TB, means state TB officer, and also I am holding the charge of Kerala State AIDS Control Society as the project director. So both programs are interlinked, and we know that we have to screen the TB patient for HIV and also for the HIV patient for the TB disease, TB infection or TB disease. So while coming to the service delivery, I think previously we were having, for example, in the TB elimination program, previously it was TB control program. So under the RNDCP, we were having the IECs like more than 2 weeks cough. We have to do the sputum microscopy from a designated microscopic center, which will be nearest to our facility or nearest to the patient. But I think nowadays NAT, the nucleic acid amplification test is using, and using the NAT machines, we have to do the test. So to avoid missing of cases. So I think we have to deliver this message, spread the message, percolate this message to the community, because it is the number one testing diagnostic facility we have to use is the NAT facility. And other thing, new development in this area of tuberculosis elimination is the tuberculosis infection detection test, like IGRA test and CyTB test. So, then we have another challenge like increasing kind of MDR TB, drug-resistant TB, and also, as all of you know, nowadays the intravenous drug users are more, and last year's total cases we have around more than 15% of cases are from the youngsters, like from between 19 years and 25 years. So we have to integrate all the programs, all the treating facilities on a single platform to for the coverage, as well as for as the national program for achieving the indicators and moving towards the elimination of TB program through TB elimination, as well as for the control and elimination of sexually transmitted diseases and HIV/AIDS. So I think this coalition, all the participants, I know all are very much dedicated and interested. Dr. Praveen himself came to our institution and discussed regarding the meeting. From the beginning, now I think we will have a small number of participants are more. So I think we will have a discussions, presentations, etc. after this introduction. I will have I am having a small presentation. I will try to share it.
Madam, inauguration start, madam.
Okay.
So, as I said, we have 18 associations with us, and IMA, our parent association, is the patron of all this program. So I invite Sreejith sir, State President IMA, for the inaugural address, and I request him to inaugurate this coalition meeting.
No, can you hear me?
Yes, sir. Yes, sir.
Dr. Praveen K S, Dr. Sakeena, Dr. Shameem, Dr. Riyas, Dr. Arvind Rikukumar, Dr. Satyabama, Dr. Arsha Kalyath, and the representatives or leaders of various 80 professional associations to participate come here. And my dear friends, tuberculosis, or is previously called in Puranas and Upanishads as Rajesh, and it has been previously called as classified as the disease of kings and queens. As far as TB in Kerala is concerned, I think now there are 21,290 patients are here. I think detected patients are here, and the actually the TB burden in India is 1/4 of the total TB patients all over the world. In through the various processes like DOTS, RNTCP, and we have been making our best trials to eliminate, to control and eliminate TB. But nowadays, recently we have I had heard that there are newer strategies are formed to eliminate TB. Some of the I think which I had is one is the CYTB skin test for the field workers, then expanding TB treatment to the relatives of the patients, newer shorter regimens for treatment, TB vaccines, ultra portable handset of TB X-rays, inclusion of newer diagnostic screening tests, shorter during regimens, digital recording treatments, adherence and clinical follow-up, then post-treatment of and rehabilitation of the patients, integrated digital platform, lead role of uh, block level unity, public health units, etc., and also genomic surveillance. Through these methods, and also the the relation with the TB to the and diabetic patients, tobacco users, and lung diseases is very important. So the test of IGRA, etc., it will be very good for that. By this, we can eliminate then or control. More, our aim is to eliminate TB, just like we had eliminated smallpox from the face of the world. The prevention of TB infection and active disease and early diagnosis and treatment, avoid the complications, etc. We can eliminate, or we can try our level best to eliminate TB from the face of the world. As as the president of the IMA, I tell you we have got 48,000 members in IMA, and all the other associations are under IMA, and they all are doing very well and taking it as a great project. We have to we will try our level best to eliminate TB and its complications from Kerala people completely. So through steps and Nikshay Posha Yojana and 2 years GD order, we can to help the poor people of TB patients in the poor TB patients. We can try our level best to eliminate TB. You may be remembering one of our famous poets, Keats, died because of TB. In Kerala, the the popular poet Changbar also died of TB. So this TB may come to, or it may affect anybody in society. I know many doctors who have some complications of TB, and some of them died in their young ages itself. So we can try our level best in this uh, with our combined efforts. So this coalition of professional medical association meeting for elimination of TB. Let me inaugurate this function and let the webinar series continue for the I think for 1 week. I think. Thank you.
Thank you, sir. Thank you very much. Now I invite Shashidharan sir, State Secretary IMA. Shashidharan sir join ചെയ്തിട്ടുണ്ടോ എന്ന് അറിയില്ല. ഇല്ലാന്ന് തോന്നുന്നു. കണ്ടില്ല. So now I invite President of APCCM, Sanjeev Nair sir, for the felicitation. Sanjeev Nair sir, as we know, is a leading tuberculosis expert in the state and a very valued resource person, and as a regular speaker in all the TB programs in the state and as well as national level. So I invite Sanjeev sir.
Thank you, Dr. Praveen, State TB Officer, Madam, and all other dignitaries here. Srivilasan sir is part of our family, APCCM, so we closely associated. So a lot of overlap between various associations. I was initially a member of KGMOA, then became a member of KGMCTA and IMA, obviously. So I think our associations have a lot of linkages. Many of us are members of various associations, and I'm happy that I've been able to join this coalition meeting for the very first time. Of course, my term is getting over by September, and I think one of the requests I'll place up front to Dr. Praveen is that, maybe we should have a system of periodically updating our membership, because leaders of various organizations change. And with every annual change or whatever is the frequency of change of organizations, the new leaders should come in. I have also invited Dr. Judo, the secretary of our organization, who's also there in this meeting. And since his term continues over the next year as well, so continuity will be there. And of course, when I finish my term, I'll hand over to Dr. Prakash. So I'm happy that all the specialties have come together. In fact, today afternoon, Arvind and I were in another meeting of the Medical College Core Committee, where at the medical college level, we were trying to see how we could contribute towards TB elimination. The principal, superintendent, and everybody was actively involved in that particular meeting. So each of us can do our bit. There's still a lot to do. It has been a long battle. I started as district TB officer way back in 1999. So for me personally, it has been a 26-year-old journey in TB, and I've seen the successes and difficulties over the years. And tuberculosis elimination is not something that we can manage over a short period of time. All of us have to work together, put in a lot of effort. All sectors have to be involved, not just the health sector. We are all professional associations. In fact, we need to go beyond that, include other government departments, non-government organizations, and so much has been done in the past. And I think in the future also we'll be getting people together to work towards TB elimination. I promise all kind of support from my organization, APCCM. We have been doing our bit for, MDR TB preventive therapy, and so many other things. And of course, general TB management, being the so-called TB specialist, patients come to us, and clinical care as well as guidance on treatment, diagnosis, and all comes from our side as well. So whatever support is needed, I personally promised Praveen and Shameem all kind of support, and I'm sure that our organization will be effectively contributing to your efforts of the coalition. Thank you.
Thank you very much, sir. Now I invite Dr. Bijoy, representing KGMOA. She is the managing editor of KGMOA.
എല്ലാവർക്കും നമസ്കാരം. ബഹുമാനപ്പെട്ട ഡോക്ടർ സക്കീന മാഡം, ഡോക്ടർ പ്രവീൺ എന്നിവിടെ സന്നിഹിതരായിട്ടുള്ള കേരളത്തിലെ ഗവൺമെന്റ് മേഖലയിൽ, ആരോഗ്യ മേഖലയിൽ പ്രവർത്തിക്കുന്ന വിവിധ സംഘടനകളുടെ പ്രതിനിധികൾ, വളരെയധികം സന്തോഷമുണ്ട് ഇങ്ങനത്തെ ഒരു പ്ലാറ്റ്ഫോമിൽ. കാരണം സർക്കാർ ഡോക്ടർമാരുടെ ഒരു പ്രതിനിധി എന്നുള്ള രീതിയിൽ TB എലിമിനേഷൻ ഇപ്പോ മുൻപ് ആമുഖത്തിൽ സംസാരിച്ച സക്കീന മാഡം പറഞ്ഞു കഴിഞ്ഞു. 60% ആളുകൾ പ്രൈവറ്റ് സെക്ടറിനെ ആശ്രയിക്കുന്ന കേരളത്തിൽ നമുക്കൊരു TB എലിമിനേഷൻ എന്നുള്ള ലക്ഷ്യം നമ്മൾക്ക് പ്രാപ്യമാവണമെങ്കിൽ നമ്മൾക്ക് പബ്ലിക് പ്രൈവറ്റ് സെക്ടേഴ്സിന്റെ കറക്റ്റ് ആയിട്ടുള്ള ഒരു കോർഡിനേഷൻ, ചേർന്നുള്ള ഒരു പ്രവർത്തനം, അതുകൊണ്ട് മാത്രമേ നമുക്ക് സാധ്യമാവുകയുള്ളൂ. അതിനു വേണ്ടിയിട്ടുള്ള വളരെ പ്രോആക്റ്റീവ് ആയിട്ടുള്ള ഒരു സ്റ്റെപ്പിന്റെ ഭാഗമായിട്ടാണ് നാം എല്ലാവരും ഇവിടെ നിൽക്കുന്നത്. നമ്മൾക്കറിയാം, കേരള മോഡൽ ആരോഗ്യം എല്ലാ കാലത്തും ഒരുപാട് മുൻപന്തിയിലാണ്. സോ നാഷണൽ ടാർഗറ്റിന്റെ മുൻപേ തന്നെ നമ്മളുടെ ടാർഗറ്റ് അച്ചീവ് ചെയ്യുന്ന രീതിയിൽ പ്രൈവറ്റ് സെക്ടേഴ്സിന്റെയും ഒരുപാട് ഇന്നോവേറ്റീവായ കാര്യങ്ങൾ TB എലിമിനേഷനിൽ നമ്മൾ ഓൾറെഡി തന്നെ ചെയ്തിട്ടുണ്ട്. സ്റ്റെപ്സ് എന്ന് പറഞ്ഞ് മുൻപ് തന്നെ നമ്മൾ പ്രൈവറ്റ് ഹോസ്പിറ്റൽസിന്റെ ഇൻവോൾവ്മെന്റ് നമ്മൾ ഈ മേഖലയിൽ നമ്മൾ കൊണ്ടുവന്നിട്ടുണ്ട്. സോ ഇപ്പോഴും നമ്മൾ ഈ എലിമിനേഷൻ പ്രോഗ്രാമിന്റെ ഭാഗമായിട്ടുള്ള കൂടുതൽ സയന്റിഫിക് നോളജസ് എല്ലാ സംഘടനകളുടെയും ഈ മേഖലയിൽ പ്രവർത്തിക്കുന്ന എല്ലാ ഓർഗനൈസേഴ്സിന്റെയും പ്രൊഫഷണൽസിന്റെയും ഒരു കൂട്ടായ്മയോടുകൂടി കൂടുതൽ മെച്ചപ്പെട്ട ഒരു TB എലിമിനേഷൻ ഗോൾസ് നമുക്ക് നേടാൻ സാധ്യമാവുന്ന ഒരു അവസ്ഥയിലേക്ക് നമ്മൾ മുന്നോട്ട് നീങ്ങുകയാണ്. അതിനിവിടെ എത്തിച്ചേർന്ന് അതിന്റെ ഫസ്റ്റ് സ്റ്റെപ്പ് എന്നുള്ള രീതിയിൽ ഇവിടെ വന്ന എല്ലാവരെയും അഭിവാദ്യം ചെയ്യുന്നു. നമ്മൾക്ക് എല്ലാവർക്കും ഒത്തൊരുമിച്ച് നമ്മൾക്ക് TB എലിമിനേഷൻ എന്നുള്ള നമ്മളുടെ ലക്ഷ്യത്തിലേക്ക് കടക്കാം. കാരണം നമ്മൾ എല്ലാവർക്കും അറിയുന്നത് പോലെ അതൊരു രോഗം മാത്രമല്ല, അതൊരു സൊസൈറ്റിയുടെ ഇഷ്യൂ കൂടിയാണ്. അപ്പോൾ അതുകൊണ്ട് നമ്മൾക്ക് എല്ലാവർക്കും ഒത്തൊരുമിച്ച് ഈ ലക്ഷ്യത്തിലേക്ക് നടക്കാം. എല്ലാവർക്കും അഭിവാദ്യം ചെയ്യുന്നു. നന്ദി.
Nani, thank you, Dr. Vijay. Now I invite Dr. Riyaz Sai, State President, Indian Academy of Pediatrics, IAP Kerala.
Respected chair of this meeting, Dr. Sakeena Madam, the convener or the chairman of the coalition, Praveen, then our Sreejith sir, who is the president of Indian Medical Association. So as everybody was telling, this is a very, very ambitious union because tuberculosis is something which we all need to fight together. So I have been attending this coalition meeting even before also, but I think it was the first time it is being held in Zoom. And this will be good because more people can attend and we can spread the message all over the state. Then regarding Indian Academy of Pediatrics, we along with the TB wing of the DHS as well as other organizations including IMA, we regularly give update to our pediatricians regarding the newer guidelines in management of tuberculosis. So to this coalition, I would like to place one request, that is regarding the availability of CTB test for diagnosing tuberculosis in children. Because as we know, the tuberculosis is a positive bacillary disease in children, as well as it is very difficult to get sputum sample from children. So we were heavily dependent upon the Mandu test now, which is not available. Even though IGRA is available, it is no, we were not getting it regularly, and we have to wait for a long period before it is being done. So by that time, the contact may give tuberculosis to the child because we are not starting the prophylaxis till the IGRA is being done. So I think it will be a good idea if we can all push to the Central TB Division to make CTB available for children. We can actually start it from our state, and the Indian Academy of Pediatrics will offer all the support in this venture. And best wishes. And I'm not taking more time. We can go for the academics. Thank you. Thank you, Dr. Praveen, once again.
Thank you, sir. Now I invite a representative from KGM-CTA, if anyone is there. I actually couldn't find anyone. So from Kerala Government Postgraduate Medical Teachers Association, if anyone is there, kindly unmute and give the felicitation. I think there is no one is there. So I invite our dear Aravind, who is the Clinical Infectious Disease Society President of Kerala, and a person who doesn't need any introduction to the Kerala audience. So over to Aravind.
Good evening, respected Sakeena Madam, Dr. Praveen, Sreejith sir, Riyaz sir, Sanjeev sir, and representatives of all the associations. So, SITS is actually a very small association in Kerala. We started only around 3 years back. So, the members are actually the infectious disease, people who are working in infectious disease expertise in ID. So, basically, Dr. Sherry has been working along with the coalition for quite some time. So, first of all, I would like to thank the entire state TB team and the NTB program for giving us this opportunity to be part of this the coalition, and we wish all success for this program, and extend all support from our side, from our members, to be part of this great mission.
Thank you, Aravind. And now I invite a representative from Academy of Clinical Microbiology. I think Satyabama Madam is there.
Thank you, Praveen. Actually, I had come for the meeting twice before offline. Can you hear me?
Yes, madam.
Okay. I had come for the meeting twice earlier. The classes and everything, like the presentations, everything was very interesting. And I think last time when we met, we said that we will meet offline at least once in 3 months. And I think that should continue so that we can get more and more knowledge from there and spread it to our PGs in our departments. Actually, after coming from that coalition meeting, the next day itself, I taught my PGs what I learned over there. the new techniques and all that. I just taught my PGs. We can spread awareness. So I think that even though a very young association, we can do a lot to eliminate TB. To eliminate TB. That's all.
Thank you very much, madam. Now I invite the president or representative from Indian Association of Dermatologists and Venereologists, if someone has joined. Dr. Bobby has come for the coalition meeting representing the association, but I think now today no one has joined. So anyone from the KFOG? From Ophthalmological Society? Then from Indian Association of Preventive and Social Medicine? Sairu madam, I think we have invited Sairu madam. I think madam has not joined.
Not joined.
Okay. Then Kerala Orthopedic Association. Then QPMPA, Qualified Private Medical Practitioners Association. Then Academy of Family Physicians of India. Then anyone from Association of Surgeons. If anyone has joined from any other
Secretary of ASI,
association,
but I'm
Dr. Engine, I think, as Association of Surgeons. Dr. Engine, please.
Thank you.
Okay. Thank you. Thank you for joining, Dr. Engine, representing Association of Surgeons in India. So if anyone I have missed, kindly unmute.
Praveen, Dr. Rajendra sir is there. He is the chairman of the IMA Committee for Children and Adolescents.
Okay, sir, Rajendra sir.
I am happy to hear that for the elimination of tuberculosis, such a coalition is formed. I am at present a part of IMA, the committee chairman for Child and Adolescent Health Committee. That is one. Number two, I am the incoming president of the Indian Association of Pediatric Surgeons, Kerala State Chapter. I think this Indian Association of Pediatric Surgeons is not aware of this matter. I don't see anybody from the IAPS in this meeting. Of course, we can collaborate with this coalition. We will take the common steps forward to eliminate tuberculosis. I am happy to extend all support, and we will share the activities. Thank you very much.
Thank you, sir. Thank you for joining and offering the support. Now I invite Dr. Arshad Kalyat, sir, Director in Charge, State TB Training and Demonstration Center.
Yes, respected State TB Officer, Dr. Sakeena Madam, Dr. Srivilasan sir, and Dr. Riya sir, Dr. Rajendra sir, and Chairman Dr. Praveen, Vice Chairman Dr. Sreejith, and esteemed representatives of the coalition partners. And I'll go through it fast. The strength of the coalition lies in its diversity, I think, because it's bringing together experts from various medical specialties, pooling their knowledge and building bridges of collaboration. So I think that may these webinars, our webinars, ignite new ideas, strengthen partnerships, and bring us closer to our aim of a TB-free Kerala and India later. So thank you and best wishes for the success of this webinar, and thank you all.
Thank you, sir. We have few more persons who are involved in the office bearers of this coalition. We have Dr. Sreejith K, who is the Vice Chairman. I invite Dr. Sreejith K.
Thank you, Praveen. My organization is already represented by Riyaz sir, so I wish all best wishes. But as a vice president of this coalition, I think we need to penetrate to more organizations. But I'm happy with attendance now, but we need to do more.
Thank you, Sreejith. And we also have Dr. Shameem, who always represent IMA in this coalition. He is also a pulmonologist.
Good evening, Dr. Praveen. Can you hear me?
Yes, yes.
Okay. So, respected IMA President, Sreejith sir, Sanjeev sir, and all the senior leaders, I am representing IMA in this platform. The importance of coalition at this time, one thing is we are going for elimination of TB. So TB is not only pulmonary TB, there is extrapulmonary TB which is increasing nowadays. So this platform can be made used to discuss various cases of difficult cases which we come across in treating extrapulmonary tuberculosis. When Sanjeev sir is there, many great people who are involved in this field. He is part of this coalition. So I am sure this will be a great help for all the doctors across the state. I wish all the best for this coalition. Thank you.
Thank you, Dr. Shameem. We will move forward to the webinar. Before that, I also thank the Salima, who is the convener of this coalition, and also the doctors from the state TB cell, my dear friend Dr. Krishna, Dr. I think Dr. Shias is also there. Then the WHO consultants, Dr. Aparna and team. And I also thank all the staff from the state TB cell for coordinating this, for helping in coordinating this program. So we will now move forward with today's webinar. I invite Sakeena Madam to present the topic.
Please allow me to share the screen.
Yes, 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 ma'am.
Is it visible now?
Yes, madam, visible.
Full screen.
Yes, madam, it's full screen and you're audible.
Okay. So I'm doing a brief overview. National TB Elimination Program. We have now the steps system. So a Kerala model for sustainable low-cost system acceptable to the individual. We have discussed this. I think everybody knows this. This is a consortium with step center in each private sector and a coalition of professional medical association. So private hospital consortium, the consortium of hospital managements based on social responsibility of private sector hospital management, and ensures policy decision within all private hospitals to establish steps and ensure standard TB care in India. So the last coalition meeting, we have the selected chairman, Kerala Government Medical Officers Association, represented by Dr. Praveen, Vice Chairman, Indian Association of Pediatrics, represented by Dr. Sreejith, and Patron IMA ex officio, represented by Dr. Shameem, and Member Secretary, State TB Officer, and Convener, State PPM Coordinator, Dr. Salima. So these are our members. Coming to the coalition of Professional Medical Association, it was actually reconstituted in 2024. The mission is to ensure uniform high standard of TB prevention, diagnosis, treatment, and social support, which is accessible, affordable, and quality assured to all individuals who are vulnerable to develop TB or with TB in our state. Role of member organization, the coalition, this is we have to discuss, and this is our role to train all members of organization practicing TB on standard of TB care in India, and to advocate with all members to use free access to quality assured TB diagnostics, including drug susceptibility testing under NTEP program, National TB Elimination Program, and daily fixed dose anti-treatment TB treatment, and second line ATT and ICT support for treatment adherence. So they need counseling, testing, etc. To encourage and support all practitioners to enroll presumptive TB cases in NICSHE, either at individual level or institutional level, to reduce the delay in diagnosis. So for each and every TB patient, they need counseling before treatment. We have to assess their standard of living. For example, whether they can afford traveling, they can afford the other supportive measures, and all such system is there. And also we are giving their financial support and also food and food kits, etc., through the programs and through free donations, through social CSR funds, etc. And now Kerala, in our state, we have the LSCD projects. They are placing LSCD projects for these for the food supply and financial support to the patients. But unfortunately, the financial support from voluntary part for the CSR, etc., we have some deficiency compared to other state. To encourage and support all practitioners to enroll presumptive TB cases in NICSHE, either at individual level or institutional level, to reduce the delay in diagnosis. For example, in Ernakulam district nowadays, we try to encourage diagnosis from private sector, and also whenever we diagnose a case or test a case, we have to report it in the NICSHE portal, where we are getting the TB testing and TB diagnostic and follow-up details. So the NICSHE portal entry will be the indicator, or it will show our TB elimination program in the state. So every facility who are doing the testing as well as the treatment and follow matters, they have to enroll in the NICSHE portal, and the NICSHE portal notification is one of the important indicator in the National TB Elimination Program. So in Ernakulam, some major hospitals, they requested that NICSHE portal training, and the Ernakulam team, they have started this. Role of member organization in the coalition continues to ensure that all members of the association will notify all cases of TB diagnosed at the institution through NICSHE web portal or mobile application. I request all to establish this system, even if they cannot do to the portal, means to using a system or laptop. Please encourage your staff to use the mobile application also. To encourage and support all practitioners to actively follow up all their patients for treatment adherence and to report treatment outcome. To act as an interface for public-private partnership for TB control by linking private health facilities to National TB Elimination Program diagnostics and treatment. So we have two important portals here to discuss. One NICSHE portal and the other the SOCH portal. SOCH is for the HIV part of the program. Actually, it comes under NACO, National AIDS Control Program. So strengthening overall care for HIV beneficiaries is the SOCH. So these two portals will show the elimination and diagnostic testing and service delivery part of our state. So we have to upload the activities in these two portals. Then free testing and free treating centers, and need a referral back system also. So everybody should be aware of these free testing and treatment centers, especially without losing the patients patient to the private sector, because even though we have facility in government sectors and we are providing free service delivery, sometimes the private facilities, if our system, they are not sending back the patient properly, they are not sending the diagnosis reports timely to the referred physician, then there will be a difficulty in collaborating the mechanism. So we are giving strict directions to back refer the patients and send the patients and update the referring physician regarding the patient's report and other things. So another area we have to discuss in future, or if I don't know today we have the time, but the areas I'm telling, one is NICSHE portal entry, then the referral and referral back system, and sample transportation area, and the possibilities of sample transportation to the nearest NAT facility, CB NAT or TrueNAT. So in some district, we have in the state, as all of you know, we have a hub and spoke referral system. So in that referral system, from the peripheral small in a panchayat, if there is a patient, then we have to do a test that is not doing in from that a family health center or from the PHC. We are having a system of taking the sample, transporting the sample to the district level hub lab and giving the report to back. So in that system, for example, Ernakulam, urban area, they have included the sample transportation of TB samples also. But I request all of you to give direction if we are sending the sample to a higher level lab or any other free service delivery lab doing that facility in government sector or somewhere else. We have to keep the temperature, maintain the temperature, and as well as we have to send within 1 day itself, because otherwise we know that the commensal growth is within 2 hours and the TB mycobacteria tuberculosis growth takes 20 hours. So the commensal bacteria will grow and destroy the TB bacteria, and we will be getting a negative result. So to get early diagnosis, from timely diagnosis and management of the case, sample transportation, sample generation also, we have to give advice to the patient regarding how to take effective sample and all these things. That will also we will be discussing in future. Then another area is capacity building, need assessment of this group, and we can select topic which are on a priority basis for the these members, and we can have different topics to be discussed and select the topics and discuss in this group. And the IEC, especially I request all the colleagues in this group to utilize the waiting area of especially private hospitals. In our hospitals also we are promoting, but the private hospital area people will be waiting for a long time. So we can have the IEC, the materials and the messages to the community regarding these National TB Elimination Program and other communicable diseases, HIV, AIDS detection, the facilities available nearby, and all these things we can exhibit, and we can utilize various methods of doing the IEC, like visual media and audio, all things, video, everything. This is a small snapshot of current scenario as TB incidence per lakh population globally during 2024. It is 134, and in India 195. Kerala it is approximately 64. And TB death per lakh population we have 6.3, but it is not a very low number. Actually, every year we are having around 2,000 deaths per year due to TB, and every month we are having around 156 deaths. So we have to prevent death. So early detection, delayed, we have to avoid delayed diagnosis, delayed case detection, and proper treatment. For this, now there is a system of giving differentiated TB care. Like we are assessing every detected new registered cases in every 2 weeks, and there is a criteria for assessment, and using the criteria in the NICSHI portal itself, there is an automatic pop-up message like whether the patient to be treated from that center or to refer our higher center. And it is depending upon the physician's decision. If the physician feels that the patient to be referred and the NICSHI portal tells that no need of referral, then also the physician decision will be final. So this area also we are giving importance to these bi-weekly assessment of patient. So I request all of you to do a bi-weekly assessment, because nowadays there are some complaints regarding losing of vision, etc. From without having much follow-up and care to the patient during the treatment. So I am skipping this. Coming to CITB, we have discussed this topic. So there is a government guideline for using CITB skin test for detecting and treating TB infection. So TB infection and TB disease, I hope everybody will be knowing the difference. During the 2020 National TB prevalence study, 40% of cases were asymptomatic. So need of X-ray of vulnerable group. We are taking the X-ray, and the national program also directing us to take the X-ray of vulnerable group. But when comparing the total number of chest X-ray utilized done for chest TB symptomatic or presumptive TB examination from a private hospital and government hospital across the state, I think every day that we will be doing lot of X-rays from private sector, but it is not coming to the Nikshay portal, as well as just testing for the TB symptoms, sputum testing, NAT testing or microscopic testing. So these also we are missing. Towards the national TB elimination, we are here we are losing two important indicators. So I am requesting help of all, and TB is a disease spectrum. So when the healthy individual comes to exposure, we will be having TB infection, and as all of you know, when the immunity is high and everything is okay, patient will have only infection. But when the immunity comes down, we will be have the dormant Mycobacterium tuberculosis will be multiplying, and it is getting into TB disease. So for before active TB disease, we have to detect TB infection. For this, above 18 years of age, we are using now as per the program guideline on policy direction. We are using 18 years above TB, and from above 5 years and 80 years, we are using IGRA. So the ITB intradermal test, we are age affected 18 years and unaffected by BCG vaccination status. Storage must be 2 to 8 degrees Celsius. Field friendly, it is economic, and not the antigen is not reactant to the BCG vaccine. State is targeting to achieve 100% upfront NAT by the end of 2025. We have 127 TrueNAT machines in public sector and 54 machines in private sector, and 41 CBNAT machines in public sector and 26 machines in private sector. In 2025, 75% of samples were offered NAT test as the first test, and Kerala was awarded the award for best performance under this category on World TB Day 2025, March 24. So state is in the process of accreditation of private laboratories for implementing this easily, so that we can have testing from private sector, and in this diagnostic area we will have more collaboration and good achievement. Trend of TB notified cases and testing rate. Here you can see when the testing rate is more, when we do number of tests done per lakh population, the cases are also decreasing. When the detection improves, we are finding more cases and treating timely, so it is like in a downward trend. This is sample transportation via India Post. Dr. Rajaram, I remember Dr. Rajaram and team, they have done a very good effort, and now the state has accepted this, and they scaled up to all programs. So we have signed MOU was signed with India Post in February 2025 for the transportation of TB samples as per the National TB Elimination Programme norms, and now the government of Kerala is in the process of expanding the same MOU of the transportation of all types of diagnostic samples. This the postman will be coming and taking the sample and handing over to our laboratories. I explained differentiated TB care. Then the BPALM regime, I think all the experts are sitting here. Just for completion's sake, I'm showing this slide. The BPALM regimen benefits: shorter duration for multi-drug resistant TB, 6 months duration than traditional MDR TB treatments, and lower cost and reduced pill burden. High efficacy is there, and hence because of it is short duration, and it is easy to have the medicine, there is improved compliance and improved clinical outcomes. So BPALM regimen must be the first choice of treatment in eligible patients with MDR TB, regardless of their resistant status or HIV status. Then since March 2025, 24 patients were initiated on Vipalam regimen. Now we have more than 136 cases at present in the state. And I explained regarding the LSCD submitted project to support patients with TB by providing food kits worth 1,500 throughout the treatment course. Everybody can support this program. Individual supports we are getting individual supports. Some collectors, one Trivandrum collector, sub collector, and Ernakulam collector, some other leaders, our STO, all they are supporting these patients. In addition, we will be supported through a center scheme, Nikshay Portion Yojana, 1,000 rupees credited directly to patient's account throughout the treatment course. So every patient will be getting 6,000 rupees overall over a period of 6 months. State is also receiving support and diagnosis support through Nikshay Mitra initiative. This is the achievement of 100-day TB campaign. The main theme of the National TB Elimination Program here, TB Harega, Desh Jeetega. So during the 100-day campaign, state detected additional 800 cases and increasing presumptive TB testing rate from 1,468 to 1,750 per lakh population. But nowadays, after the campaign, we are having difficulty in this area because number of tests, there is a reduction. But we are now giving emphasis to the testing, detection of cases in the vulnerable population. So increases the proportion of we have the upfront NAT for diagnosis of TB, MDR TB, 15% to 70%. That also increased, and the Nikshay portal entry also we are monitoring very well. And 100% coverage of Nikshay Portion Yojana and Nikshay Mitra we got, and 30% of Panchayat will prepare for a TB-free coalition certification. Sorry, and 523 new cases found by active case finding. So that is a very good achievement. And presumptive TB testing rate increased to 2,310 per lakhs population. And the Nikshay Portion Yojana and Nikshay Mitra also there is an increase, but we have to increase this area. These two are very 30%, 23%. These are the support giving to the patients through the system and from the private organizations and volunteers. 40% Panchayat for TB-free certification. Now we have achieved. We have to achieve 100% Panchayat and local self-governments achieving the TB-free status. X-ray based screening for diagnosis of TB. Currently, we have 8 handheld X-ray machines with our institution, within our institution. Also, AA support is available in the state for the community level annual screening of vulnerable population. So, AA supported handheld X-rays are using for community TB diagnostic procedures, and we are using a comprehensive testing by using the mobile medical teams while going for screening screening and giving service through other programs also. Along with this, we are screening the vulnerable and the presumptive TB cases, those who have symptoms, and expecting 51 additional machines from the Central TB Division this year. So we can improve the X-ray diagnostic facilities for the suspected TB cases and the vulnerable populations, to screen the vulnerable population, especially there are 18 vulnerable groups we have identified in the state. So we will be able to increase the case detection, and we can eliminate or reduce the TB disease transmission and eliminate the disease as early as possible. And for elimination, every physician in the treating sector should know the program without any doubt. So in special cases, we have the different difficult to treat committees are there. Dr. Sanjeev Nair is an active member of this difficult to treat area, and our Dr. Arshad Kalir, Dr. Shias, and so many members we have, and all treating physicians, those who have any difficulty in any kind of treatment, cases of treatment, I think they can utilize the difficult to treat committee also. And I request the collaboration and support of all members in elimination of TB disease from our country, from our state. Thank you all for your patience and support. Thank you.
Thank you, dear madam, for the excellent presentation, giving an overview of the program in the state. If anyone has any